Thank you for joining today's presentation titled Housing Options for People with Developmental Disabilities. My name is Melanie McGacken. I, along with the Family Support Center of New Jersey, would like to welcome you to today's webinar. The Family Support Center of New Jersey is part of a network of affiliates under the Family Resource Network. These affiliates also include Epilepsy Services of New Jersey, Autism Family Services of New Jersey, and Caregivers of New Jersey. Each of our affiliates provides specific supports and services to the community. We encourage you to explore our websites or give us a call to see how we can assist you further. During today's webinar, Attorney Paul Pryor from the law firm of Hinkle, Fingles, Pryor & Fisher will share how families are looking beyond traditional group homes and supervised apartments and are exploring innovative housing supports for their loved ones with developmental disabilities. During today's webinar, participants will learn about the options for funding residential services, how to safeguard services for a son or daughter, and how to avoid common pitfalls when working with state agencies to obtain effective out-of-home residential services. The Family Resource Network is here to help. The Family Resource Network Navigator website provides all the details you need to learn about the FRN Health Insurance Navigator program. This program is dedicated to helping consumers learn about affordable health coverage, options, and how to obtain benefits. The Family Resource Network Health Insurance Navigator program provides trained navigators to assist people in obtaining New Jersey family care health insurance coverage in specific counties and can help you better understand your health care options and assist in completing the application. Please visit frnnavigator.org or give us a call for additional details. Before we get started, I want to review how you can best participate during today's webinar. On my screen, you will see an example of the attendee interface. You should see a similar option on your own computer desktop. Use the orange arrow to open or hide the control panel. To listen to the webinar, you have two audio options to choose from: mic and speaker or telephone. If you can't hear well using your computer speakers, you can elect to use a telephone to listen to this afternoon's session. If you have questions or comments, you can submit them using the questions panel. All questions will be collected and answered at the end of the webinar as long as time allows. Please note that at the end of the session, a brief survey will pop up. It is information that you provide that allows us to better plan future topics that will best address your needs. So we encourage you to take the minute to complete this survey. At this time, I would like to introduce this afternoon's presenter, Mr. Paul Pryor. Paul, welcome.
Thanks, Melanie. How are you?
Great. Paul, you should see a prompt on your screen in about a second.
Yep, I've got it.
Perfect.
Can you see my screen?
We can.
All right, great. Well, all right, I guess success. We did have a little bit of a scare about 20 minutes ago when my computer crashed and took an inordinate amount of time to reboot. So Melanie, sorry for the panic attack. I know I was having one on my end too. So
we are good to go.
We're good to go. Let's hope we don't have any more technical problems. So anyway, thanks, Melanie, and thanks to the Family Support Center of New Jersey. I'm Paul Pryor with Hinkle, Fingles, Pryor & Fisher, and we're here today to talk about housing for folks with developmental disabilities. It's a dense topic that we could probably talk for several hours on, and I know we're kind of on a lunch and learn schedule. So everybody, please unwrap your pastrami sandwiches and open your Cokes, and we'll get started. When we talk about housing for folks with developmental disabilities, we are in a kind of a shifting and changing environment over the last 5 years or so with respect to the types of services or the types of settings, I guess I should say, that families are contemplating for their loved ones with developmental disabilities. I actually have been doing this long enough where I kind of remember in the early part of my career, state-operated institutions is not as the primary form of housing for people with disabilities, but was certainly a significant number of folks that were still served in state-operated institutions. And group homes were starting to emerge as, and we're underway actually to their emergence to the primary form of housing and supports for persons with developmental disabilities. And that trend was scary at the time, and caused families a lot of anxiety. And over the years, it really became the in New Jersey at least, the main treatment setting or housing setting that that families relied upon. But now we're merging into a new era where families like to have a little bit more control, and they like to have a few more options in terms of housing, and they like to have a little bit more flexibility. So, now we're not only talking about group homes, which are still probably the primary method in which individuals with developmental disabilities are served in the community, but supervised apartments, supported apartments, creative housing in terms of folks, families purchasing their own piece of real estate or aligning with other families that they might, who also might have children with similar levels of needs as their own son or daughter, and creating sort of their own housing arrangement. And of course, the use of supports for in-home services in the individual's home, or in services even in the parental home under the community care program. So, but you don't get to any of this stuff, right? You don't get to any of these options, whether it's a group home, whether it's your own kind of homegrown housing arrangement, or anything else in between, unless you get access to the community care program. Now, for those of you who've been around just a little while, this is what we used to call the community care waiver, formerly known as the community care waiver, or CCW. The Division of Developmental Disabilities, in its ongoing, in my case, 20 years, desire to keep everybody guessing and everybody on their toes, changed name of the community care waiver to the community care program not too long ago. Excuse me. But the community care program is a Medicaid-based program. It is Medicaid. If you don't know, you probably should be aware that when the Division of Developmental Disabilities provides services, housing services, to an individual with a developmental disability, they are not only using state taxpayers' dollars anymore, but they're also drawing down from Medicaid dollars. And in fact, the division requires, DDD requires, that whenever possible, that individuals become eligible for Medicaid. And in fact, if an individual can be eligible for Medicaid but fails to do so, the division takes the position that it won't actually serve the individual with a developmental disability. So it really is incumbent upon families to do everything they can to make sure that they obtain and maintain eligibility for Medicaid. When you're eligible for Medicaid, you have the option of going on to the community care waiver, subject to some criteria or some requirements talked about in a few minutes. But it's the way in which the state of New Jersey shifts about 50% of the cost of housing and supports for an individual with a disability off from state taxpayers' dollars to federal taxpayers' dollars. Okay, so how do we get eligible for the community care program? First, you have to be determined eligible for services from the Division of Developmental Disabilities. Again, you don't get access to any of this stuff until such time as your child has been determined eligible for DDD services. There are separate webinars and separate discussions, separate speaking engagements, which I've done over the years on DDD eligibility, and we could talk about that for a lengthy period of time. But suffice it to say that it's important for families to know that when their son or daughter turns 18, they need to contact the Division of Developmental Disabilities, and they need to initiate an application for DDD services. And they just need to make sure they have a clinical determination of eligibility reached. And what I mean by that is there's a legal definition of what it means to have a developmental disability, and if you meet that definition, then you are entitled to services from DDD. What that definition encompasses or includes is that the individual has to have a mental or physical impairment, which is made known before the age of 22, is likely to continue for the remainder of the person's life, and results in substantial functional limitations in 3 out of 7 areas of major life activity. And those areas of major life activity include self-care, self-direction, learning, mobility, receptive and expressive language, the capacity for independent living, and the capacity for economic self-sufficiency. You have to be substantially limited in at least 3 out of those 7 areas of major life activity. So it's really important for families to kind of look at their situation in a very unvarnished and clear way. When you contact DDD when your child turns 18, there's really kind of 2 things you can do. You can either go online to the division's website, and you can find the phone number off the landing page for your regional office, and you can contact them for the county in which you live, and you can ask for the intake unit, and you can ask them to send you an application for DDD eligibility for your son or daughter. Or you can simply go on DDD's website or my firm's website and download the application in PDF and submit it to DDD. Folks should be aware that the division probably around a month to 6 weeks ago kind of updated its application. So if you have an older application sitting around, you're going to want to make sure you go back online and download the newest version. DDD does not have the option of applying online, much like the Social Security Administration does. So you kind of have to download the application or have the application mailed to you, fill it out, and send it back in. Words of caution, I've heard this from families, over the last few years. When you contact DDD when your child turns 18 and the person on the other end of the phone might say to you, you can't apply for DDD eligibility until your child is Medicaid eligible. That's not true. That just simply is not true. You can apply for DDD eligibility. You can have a clinical determination of eligibility reached, but you probably won't receive services until your child is Medicaid eligible. But simply to apply, no, your child does not yet need to be Medicaid eligible. Okay. Secondly, sometimes we hear families report back to us that division representatives tell them that they can't apply until their child turns 21. That's not true. That's just also simply untrue. You can apply at 18. Understand that services will not begin from DDD until your child reaches the age of 21 and his or her educational entitlements have ended. A child with special needs is entitled to special education-related services until the June following his or her 21st birthday. So your school district provides those services up until that time, and then, of course, when those educational entitlements end, DDD kicks in or will kick in if you time it right. And I always tell families to please apply at 18. And initiate the process when the child turns 18, and I'll tell you why. The division moves at glacial speeds, so it may take a long time for them to process your application. And frankly, over the years, I have encountered any number of situations where the division inappropriately or falsely denies an application for eligibility, in which case you will have to appeal the denial of eligibility. Now, in many instances, an eligibility denial can be reversed, with a little bit of legal advocacy, in a matter of months. But sometimes, if it's going to be a more protracted battle with the division, appeals can take a few years to resolve, a couple years to resolve. So you don't want to start the process when your child is 20, get involved in a protracted appeal, have your child lose his educational entitlements at 21, and then wait a couple more years before DDD's denial has been reversed. And of course, in the interim, the kid is sitting home with you, watching YouTube videos, drinking soda, and eating potato chips. So, and all the gains and all the progress that your child has made while in school are lost. And lastly, on this topic, I want to remind you that it's super important for folks to understand that even if your child has once been determined eligible for DDD services, they might not be eligible anymore. And what I mean by that is, and let me clarify, on January 1st, 2013, children under the age of 21 were shifted by the state of New Jersey from the Division of Developmental Disabilities to the Department of Children and Families, the Children's System of Care. So anyone under the age of 16 on January 1st, 2013 lost their DDD eligibility, okay? And so those folks have to go about the process of reapplying and have a determination reached again. It's a pain in the neck. You didn't make the rules. I didn't make the rules, but those are the rules. So you have to remember that even if you applied when your child was like 3 years old, when you first received a diagnosis of something, there's a really good chance your child has lost his eligibility for DDD as of January 1st, 2013, if that child was under the age of 16. Don't be fooled by I hear some of you, I can almost hear some of you out there saying, oh, my kid's with CSOC, or, you know, I'm with Perform Care, I'll be fine. That's not true. You have to reapply. It's not an automatic transfer from Perform Care / CSOC over to DDD. And what we find is, although in more recent years, folks over at Perform Care and CSOC have been a lot better about reminding families to reapply when their kid turns 18, you know, you can't bank on the fact that you're going to get a reminder from them. Okay, so the first way you get on the community care program is you make sure your kid is DDD eligible. The person has to have income, earned or unearned income, less than $2,100 a month, and these are gross numbers, by the way. Has to have assets less than $2,000 and must meet a quote-unquote institutional level of care. Now, what does that mean? What that means is, if the person wasn't receiving services from the division under the community care program, then they would likely need or would need to receive services in an institution. All right, that doesn't mean that they are going to be institutionalized. It doesn't mean that they have to be institutionalized. That just means they quote unquote have to meet an institutional level of care. This is where it's very important, again, to look at things in an unvarnished way. If someone was not providing some level of support to the child, the adult child at this point, whether that's a family member, a natural support, a professional caregiver, would this person be able to live on his or her own, right? Would they be able to do the things that you or I do? Remember, no one is providing any level of prompt or support or reminder or prosthetic tool in order to remind that person to take a shower, brush their teeth, attend to their activities of daily living, take their medication, get to program on time, pay their bills, etc. And that's the kind of services we're talking about. If no one was around to help with those things or to remind or to physically assist with those types of activities, then the individual would probably end up in an institution and require an institutional level of care. All right. So how do you apply? How do you apply for the community care program? All right. So again, applications for the CCP can only be obtained through DDD. It's DDD's application. It's DDD's waiver. So you've got to get the application through DDD, which gets me back to why I spent a few minutes, so much time on making sure that your child was eligible. And applications are given for the CCP for individuals who have reached the top of the community care program waiting list, or individuals who are determined to be an emergency. And I'm going to talk about both of those in turn. So the community care program waiting list. Those who've been around for a while, this is now the CCP waiting list, formerly known as the CCW waiting list, formerly known as the housing waiting list. So it's all kind of the same thing. They just kind of changed the name, as I said before, to keep everybody guessing. So your child can go on the CCP waiting list when the youngest parent turns 55 years old. But let me back up before we go any further. When I talk about the waiting list for CCP, it's important for you to know that the CCP waiting list is broken into two broad categories: the priority category and the general category. All right, you want to have your child's name added to the priority category. It's the only one that moves. The other category, might as well just be called go away, because it's more or less a registry than it is anything else. No one's getting off the general category of the waiting list by simply just being on it and waiting their turn, because the priority category list of the waiting list is so long. Your child's name can go on the priority category of the waiting list when the youngest parent turns 55. Okay, so if you've got a wide spread between mom and dad in terms of age, you got to wait for the youngest parent to turn 55. It is not in the division's discretion. Once both parents turn 55, they have to add the child's name to the waiting list at that point. However, guys, it's important to remember the Division of Developmental Disabilities is not the AARP. They are not going to come find you when the youngest one of you turns 55. You got to go find them. So mark on your calendars your 55th birthday, and when that occurs, you call up the division on your birthday, and you say, "Look, it's my birthday. I want to add my kid's name to the priority category of the waiting list." You can do that through the division. You can do that through your support coordinator, but it's really important to make sure that it gets done. And if you're already over the age of 55, my advice would be to call the division this afternoon and have your child's name added to the priority category of the waiting list right away. And I won't spend a lot of time on it, but if you are over the age of 55 and your child has already been receiving services from DDD, if you've had annual ISP, IHPs, whatnot, there may be ways to have your child's name added retroactively to your 55th birthday, but time doesn't permit us to talk about that in depth. Now, the other way to get on the priority category of the CCP waiting list is there are some exceptions to the age 55 rule, and they largely have to do with situations which are very tenuous, are very difficult in the family home. So if you have a child with extreme behaviors, assaultive, aggressive, self-injurious, they punch, kick, scratch, bite the caregivers, mom and dad, it's likely that we can use those circumstances to have your child's name added to the priority category of the waiting list. If your child has significant medical needs, feeding tubes and whatnot, or requires intense medical oversight, then your child's name can probably be added to the priority category of the waiting list. Other factors which are not on this slide, the health of the parents. I live in a backwards world where what's bad is good and what's good is bad. Family comes in and they say, I'm in remission from whatever scary diagnosis. The other parent says, I've had like 3 heart attacks, and, my kid has some pretty significant behaviors, self-injurious, aggressive, elopement, property destruction, whatever it might be. It's getting to the point where I'm, having a really hard time keeping up. We can get that child's name added to the priority category of the waiting list relatively easily. So kind of, again, you got to look at the circumstances of your life in a very unvarnished way. And even if the youngest parent has not yet turned 55 and the situation at home is really difficult, then we can, you can get your child's name added to the priority category of the list regardless of the youngest parent's age or either parent's age. And it's a very long list, guys. So the sooner you get on, the sooner you get off. And nobody is moving the moving van, back in the moving van up to your house and taking your kid tomorrow if you get your kid's name put on the priority category of the waiting list. It's often the concern I hear out of parents is, I'm not ready to place my kid. Well, you don't have to, because in 2018, at the end of 2018, basically the folks that are at the top of the waiting list went on in about 2008. So, you got another decade or so to wait before you have to worry about this stuff. Okay. So don't hesitate. Do what you can to get your child's name on the waiting list as soon as possible. Emergencies are another circumstance where the division will provide families with a community care program application as well. Emergencies are circumstances where, the situation at home has gotten so bad right? Much like I just described, the behaviors of the individual, the medical needs of the individual, the health of the parents, the constellation of all of those things are so significant that the person cannot be served safely at home anymore, or is placing others' safety at jeopardy. So there is a legal definition of what it means to be an emergency. The individual is likely or will become homeless, or the individual is in imminent peril. So these are the circumstances where, if you look at your life in a very objective way, and you start to think about, what's really going on a day-to-day basis, oftentimes families can use this emergency sort of as determination to get access to the CCP application right away. And yes, that does have the effect of sort of jumping the waiting list. Over the years, I've had all kinds of circumstances, not the least of which are, extreme behaviors of the child. Maybe a parent has gotten, very ill, become very ill. And, maybe if the other parent is still around, they're not only providing caregiving services to the individual, the adult child with special needs, but also their spouse who's very, very ill. Death of one or both parents, and now the adult child is living with someone other than a parent, like a sibling or other family member, or there's just no one there, no one around to provide, the level of supports that the individual needs. That's another way to get to the top of the waiting list and get access to the CCP. Okay. I don't want to spend too much time on emergencies, but the division can provide supports in the event of an emergency to help offset or mitigate its effects. The division will supply a residential placement. The initial placement does not have to be, necessarily an appropriate placement in an emergency. They can actually just simply say, we have an opening in a group home or a supervised apartment or another type of setting in order to mitigate the emergency or to avoid the individual from being homeless. The legal requirement is that they have to provide a placement which will at least provide for the individual's food, shelter, and personal safety. The placement does have to be reviewed after a 30-day period of time, and to determine if it is appropriate or not, and to find out what the barriers to the appropriate placement are, and to help and to begin the process of searching for an appropriate placement. Obviously, the best thing to do is to get on the waiting list for the CCP as fast as possible, move your way to the top of the waiting list in as timely a manner as possible, and make a waiting list placement when your son or daughter's name has reached the top of the waiting list in a non-emergency circumstance, because then you have a little bit more flexibility and a lot less stress. But obviously, if you find yourselves in those stressful situations, there are remedies. You don't have to lose hope. And a lot of times in an emergency circumstance, over the years, we've worked with families. I've seen families go from out of an emergency, find a really good or create a really good residential living environment for their son or daughter. Sometimes it's always darkest before the dawn, right? So when a person is on the community care waiver, what does it provide? What does the community care program provide? So the community care program provides both residential and non-residential services, meaning residential and day services. Many of you out there may have a child who's over the age of 21 who is served by the division, but not on a residential basis. They may be going to a day program. They may be going to a community-based vocational program. They may be receiving some job supports and job coaching and training and whatnot. They may be receiving a certain level of recreational services, but they're still living with you. The community care program provides both the residential services and supports as well as the non-residential services and supports. Which is why the community care program budgets are always so much bigger. So when you're on the supports program, the day program, your child's not yet residentially placed, depending on what his tier assignment is, you can see from this chart what the total individual budget on an annual basis is between a tier A and a tier E, right? But if you're on the community care program, those budget numbers jump quite dramatically. As you can tell, just on the supports program, I mean, a Tier A is going to receive an annual budget of $19,000, and a Tier EA is going to receive an annual budget of about $78,000, right? But on the community care program, the budgets range from $44,700 to $406,000. So it is quite a significant jump, and obviously that is because we are also paying for the human capital, the direct support professionals in the individual's home. Okay. Now, there are circumstances where people cannot be on the community care waiver. They just can't be Medicaid eligible. And there's all kinds of quirky reasons for that. And they probably will apply to a certain percentage of you, given the number of you that are on this webinar. But people who, quirky little things that range from if the child has a parent that worked for the railroad, they're probably not going to be eligible for Medicaid. They have a whole different federal benefits system if you've worked for the railroad. If you are an individual with special needs who had a parent die or go on disability prior to your 18th birthday and prior to receiving SSI, you may not be eligible to go on Medicaid, although there are in certain circumstances ways around that as well, but they are more fact specific. So in those instances, the state has to provide services by utilizing state-only dollars. The state doesn't like to do that for obvious reasons, because they like to tap into federal Medicaid dollars if they can. But, look, you can't, the division for a while did take a very hardline approach that, well, if you're not on Medicaid, then we're not going to serve you, or we're not going to serve you serve you to the level of what your needs are, because, you're just simply not Medicaid eligible. I've sort of backed away from that over the years, but that's only by way of policy determination. The state statute governing DDD does require that all individuals within this jurisdiction, within this state, be served by DDD, regardless of whether they're Medicaid eligible or not. It does not put a Medicaid criteria in place. And so, sometimes the division is simply asked people to apply directly to the supports program, and which has the same income limits as the community care program. They've treated people as what they call non-DAC DACs, which is a fancy way of saying we're going to fund you out of state-only dollars, and so forth. But don't let them simply say that you cannot be served, or your child can't be served simply because your child has not been Medicaid eligible. Sometimes they try to assert that the person's level of need is not high enough to warrant community care program placement or community care program applications. So we've been involved in some battles recently that are ongoing, where if a person is a Tier A on the NJCAT, that they can't, that the division refuses to provide a community care program application. As a matter of fact, we've got several appeals about that going right now. That is a completely, in my view, illegal determination on the part of the division, and they're refusing to even give the application to the family to complete. It is both a substantive and procedural violation for them to do that. And, I know there's probably folks from the division listening to this webinar right now, no disrespect intended, but, it's just a simply wrong determination. Of course, they take a contrary position, and I'm sure someday the courts will sort all that out. All right. Now, I don't want to spend a lot of time on this. Just remember that as part of the criteria for being on the CCP, you got to keep your kid's assets below $2,000. If your child has more than $2,000 in assets in his own name, you need to spend the money down. You need to charge the child room and board or rent or whatever, or get yourself paid back out of his or her assets for therapies, trips, personal items, maybe opening up an ABLE account, which is a totally separate webinar for a separate day, using special needs trusts, etc. But it is very important to know that your child can have no more than $2,000 in assets in his or her own name from all sources combined. And if you do have those, if there are assets in excess of that, as we talk here, you need to get rid of them quickly. All right. Which takes us back to, you go through all of that, you spend all of the money down, you never have assets in the child's name to begin with, and you work your way to the top of the CCP waiting list, and everything goes smoothly. Where does that get you? Right, that gets you back to this slide that was earlier on in the slide deck. Now you're at the point where you've got your tier assignment, you've got your annual budget, you've got all of your ducks in a row, and now's the big day, and now you're ready. First of all, let me say this to families who are listening, who are naturally asking the question: what if my child's name reaches the top of the CCP waiting list and I'm still not ready to place my son or daughter outside of the home? I don't want him leaving. Okay, so first of all, can I decline? All right. So the practical answer is no. You're not going to decline. You're not going to pass up the opportunity to get your child's name on the community care program. Now, because of the way the division is currently providing residential or housing services, you're not going to decline it, because it is no longer a situation where you reach the top of the list and your kid is moving out of your house and into a group home, right? The CCP, the budget numbers that you have access to, can be used to provide supports in your home. I have had families over the last few years take the CCP, keep the child at home, and use that for an in-home budget to have caregivers and professionals come into the home to provide, supports and assistance to that individual with their activities of daily living, take them out for, therapies and recreational leisure activities, still pay for the day program, and so forth. And now you may not be consuming as much of your budget as you would if the child were in an out-of-home placement, but I don't want you to give up the spot on the CCP because you don't know when you're going to need it again. You're not, if you pass it up, yeah, theoretically you can hang out and you can wait until you're ready, but if you're ready only in an emergency, you have no time to plan. So you're going to take access to the CCP the minute it's offered to you. You're going to complete the application and you're going to get your child eligible for the CCP, and you're going to take the higher budget and you're going to use it. A lot of times families will do this. They'll go and they'll rent an apartment for for a child who can live semi-independently, an adult child who can live semi-independently, or with only minimum level of supervision. Sometimes families are going out and they're purchasing a piece of real estate, like a condo or a townhome, or they're renting an apartment. Or the child is renting the apartment for them to live in, and they're using the CCP dollars to provide the human supports and human capital in that individual's own home, right? And it's very important to understand that the CCP does not actually pay for housing. I'll get to that on the next slide, okay? But the CCP does not pay for housing. It does not pay the bricks and mortar of housing. It pays for the human capital, the human direct support professionals in that person's environment. I like to say that the community care program does not pay for the place, the bricks and mortar. It does not pay for the place. It pays for what takes place, the activities and the supports in that person's home, the day services, the transportation, the rec and leisure, and all the rest of that stuff. But it doesn't actually pay for the place. It merely pays for what takes place. And you're going to use other things to pay for the place. And for some people, you may reach the top of the CCP waiting list. You may get your child on the CCP, and you may have reached a point in your life where you have determined that, yes, my child does need an out-of-home placement in a more structured and more traditional living environment, like a supervised apartment or like a group home that is managed and run by, a professional provider agency. There are hundreds of provider agencies, subcontracted provider agencies that provide supports and services housing and professionals um, for individuals with intellectual and developmental disabilities. And essentially that provider agency uses your child's CCP budget on an annual basis to run the program, to pay their own direct support personnel to provide services to your child. Um, and they are running the program themselves. They have their staff, they have their breadth and depth of personnel. They're calling the shots. They're arranging the activities. They're running the show. You're not. At least, you're there. Obviously, you're involved, particularly if you're young and healthy enough to, oversee the program, talk with the direct support professionals, advocate when necessary on behalf of your son or daughter, oversee the program and its quality, but the day-to-day operations and the selection of personnel and so forth is not within your influence. Other families, as I mentioned before, are taking their CCP budgets and they're going in together, and they might be purchasing a piece of real estate or renting a piece of real estate. And, maybe somebody that my son went to school with your son. They're about the same age. We've always gotten along. Our kids seem to like each other, have a similar level of need. Maybe we'll go and we'll have them live together, and we'll each use our budgets to provide services in that piece of real estate, whatever it might look like. And there's a lot of advantages to that. Obviously, you as the family member get to contract with an agency of your own choosing, or you get to hire and fire, licensed and certified direct support professionals, and all the rest of that good stuff. And you have a lot more control, and you get to kind of design the program for you, or your child, I should say. So there's a lot of advantages to something like that. However, a word of caution, there are also a lot of disadvantages to something like that. With the great flexibility and with the great freedom comes, a lot of responsibility, because you and the other parent or parents become the CEOs and executive staff of your child Inc. And so, it may be great to call all the shots or to hire and fire the personnel, but it's also a real pain in the neck. Because what happens when people call out of work? What happens when people, leave the employment situation and they move on to other opportunities? Who's really designing the program? Who's really selecting the activities? In other organizations, there are people whose full-time job is to do these things that I just mentioned. And I can assure you, hiring and firing personnel is no fun experience. So you kind of have to be wary of kind of what you're getting into in terms of, what kind of responsibilities are you taking on? And remember, you have to take on these responsibilities not for the rest of your life, but for the rest of your child's life. And so who is going to be able to do these things? Who's going to be willing to do these things after you're gone? The other thing, the other word of caution is, we go into this arrangement together with some families, and, we all get along and we're all really excited. But then as time goes by, maybe we're not so excited to be together anymore. Maybe we have differences of opinions about things, or we have differences of approaches. It's just like any other partnership, whether it is a business partnership, whether it is a marriage. We all go into it really excited and really optimistic, but oftentimes as the years go by, it becomes an irreconcilable circumstance where, we can't get along anymore, and businesses split up, marriages come to an end, and these types of arrangements are subject to no different kind of outcomes. So you have to know when you go into these things who you're getting into business with, so to speak. And it's important to have agreements kind of put in place that deal with exit strategies. What happens if we can no longer get along? What happens if one of our participants can no longer, be safely served? What happens if one of the participants dies, or their level of need changes and they have to leave? what's our exit strategy, and how do we protect everyone involved to the greatest extent possible? You can mitigate the risk as much as you want, right? As much as you can in anything, but you have to know what you're getting into when you go in. If you know that there's risk going in and you can tolerate that risk, that's great. But you just have to go into it eyes wide open. All right. Now, so we talk about these arrangements, and we talk about getting access to the CCP in order to pay for the human capital. How about the place? How do we pay for the place? So there's all kinds of ways we can do that. I mean, if we're doing these as one-offs, I'm not talking about situations where we're contracting with a private provider agency to provide the housing. How do we get access to the bricks and mortar? Now, this is often being done through a series of vouchers that are available to help pay for the bricks and mortar of housing. The division is going to require you to put your name on your county's Department of Housing and Urban Development waiting list, Section 8 waiting list, HUD waiting list. Depending on the county you live in, I can almost hear some of you laughing. If you live in Essex County and, the waiting list for HUD opens up for about 3 seconds annually, and they don't even tell you when it does. And the waiting list is 1,000,000 miles long for a Section 8 voucher. It's going to be a lot more challenging to get on a Section 8, to get a Section 8 voucher than you live in let's say in some other parts of the state. But the division is going to make you add your child's name to your county's Section 8 voucher list, waiting list. Now, the state is making available to individuals state vouchers that are identical, almost, really identical, I should say, to the Section 8 vouchers. State vouchers are available through the Supportive Housing Connection, which, again, you can only get through DDD. And what it does is it's a 70-30 split in the rent. Or in the purported rent. That could be actual rent, or that can be rent in air quotes, right? Even those of you who have a child or will have a child who lives in a traditional group home, you're going to be asked to get access to a voucher to help cover the costs of that group home. And they will break it, that the provider agency who owns or operates that group home will try and break out the, quote, rent so that your son or daughter is able to contribute, a portion of their Social Security monies or other earnings towards rent, and they can get a voucher for the remainder to help cover the costs of the real estate. So a 70-30 split means that an individual has, there's a rent that's established, and the rent has to be fair market value, which is also another, somewhat nightmare, but the rent has to be fair market value. The individual has to contribute 30% of his or her income to the rent. And then, of course, the voucher covers the remaining 70%. So if the rent for something is $1,000 a month, and a person makes $500 a month, they're going to have to contribute 30% of their $500 towards the cost of the rent, and the voucher will cover the remainder. It's definitely a patchwork quilt of benefits these days, because you got to get the voucher, and you got to get make sure the income that you're earning is not so high that you don't lose access to your community care program, and essentially lose your Medicaid. And it also becomes a real challenge with respect to fair market value, because fair market value is not set by market forces. It's actually set by the Department of Housing and Urban Development. Each county has a deemed fair market value, and this slide shows you in your county what a 1-bedroom, 2-bedroom, 3-bedroom, 4-bedroom fair market value rent is. Now, you will notice as you look across this chart, depending on the county that you live in, let's say you live in Essex County and it's a 1-bedroom apartment. Let's say it's a 2-bedroom apartment, right? 1308 is the, quote, fair market value for the rent. And perhaps the actual market value, what real market forces dictate that the rent might be $2,000 a month. You're not able to contribute in excess of that 1308. You're not. I should say you're not allowed to pay in excess of that 1308. And I've heard the division say things to families like, "Well, just convince the landlord to reduce his or her rent." And I don't know about you, but I don't know of too many landlords that are willing to do that. So it becomes a challenge, and sometimes it requires families and others to have a great deal of advocacy with the division and push the division to come up with more creative answers in these particular circumstances. And I will say, and I don't always pay the division a lot of compliments. I've been suing them regularly for the last 20 years. In recent years, they have been, no, I wouldn't say easy to work with necessarily, but if pushed enough, they've been able to be reasonable and come up with some creative solutions which, permit the family to and the individual to accomplish what he or she is trying to accomplish. So, again, between the CCP and the voucher system, it's important that you get access to both of these things in order to make sure that your child's housing, if especially particularly is going to be independent and outside of a provider agency, is successful. If you're in a provider agency, they do most of this work for you, and you'll probably meet with great success because, again, they have people whose full-time job it is to manage this maze and this patchwork quilt of services. Families always ask, if I buy my own thing or I set up my own thing, should I set up a limited liability corporation? Should I set up a nonprofit entity, 501c3? What's the advantages and disadvantages of all that, particularly if we're going to purchase a piece of real estate and put it inside of LLC or inside of 501 or even inside of a special needs trust? Look, if you set up a nonprofit, you got to have a broad mission. It can't be just a home for your child, right? It has to have a broad social mission, like to provide services generally to people with developmental disabilities. You can't be such a narrow focus because the IRS will take away its nonprofit status. It does give you the ability to fundraise and entice donors to provide money or donations to you as a 501 because there's some tax advantage to the donor. Whether you have a piece of real estate owned by 501c3, an LLC, or a special needs trust, there are things that you need to be aware, particularly if you're going to get involved in a voucher system, and that is that the partners of the LLC or the stakeholders, principal stakeholders in the 501c3, or the trustees of the special needs trust cannot be things like the parent, the brother and sister, the grandparent, the spouse of the individual served. So, and these aren't my rules, and these aren't even DDD's rules. These are HUD's rules, and so there's a certain circle of people that cannot be in charge of the LLC, 501c3, or special needs trust if it's going to own housing, and that housing is going to be subject. They're going to be taking advantage of the voucher system. So, you got to find somebody else who's outside of the scope or the radius of the people I just mentioned to be, at least on paper, the folks in charge of these entities. So, but nothing is unsolvable. And parents often, come up with very creative ways to get around this and find people that can fulfill these roles that they trust, or that will take direct guidance from the family in order to make things operate smoothly. And there have been people who have met with great success in these circumstances. So there's a little bit something for everybody, whether it's a group home, whether it's a supervised apartment, whether it's a one-off creation, whether it's a conglomerate, a small confederacy of families who get together and put these things together. We live in a time that it allows for a little bit more flexibility, But don't forget, you got to go through all of the bureaucratic agita and the maze, like the waiting list, like the CCP application, like the voucher system, in order to pull all this together to make it happen. Thousands of families have done it before. Thousands of families will do it from this point forward. For those of you listening today, I assure you, you can do it too. Okay, Melanie, I ran through my slides as fast as possible. I think we have some time for some questions if there are any. So I'll.
Paul, thank you so much. So I do want to let everyone know, first I want to thank everyone for asking so many questions. But due to having over 200 questions being asked, what I'm going to try to do, yes, we knew that this was a hot topic. What I'm going to try to do is actually I've been collecting the questions throughout the session. We're going to group them in regards to the numbers of time that topic was asked about and relevancy to today's session. So the first question is going to be, do they prioritize the priority waiting list?
No. I think I know what that person is getting at. No, it's just simply you get on the priority category of the waiting list, you just simply get in line. You get to the back of the line, and you work your way through to the top, front of the line over time, generally about 10 to 12 years. Now, to the extent that they, quote, prioritize the list, that's when we get back to emergencies. If you're on the list and, a situation crops up where, the health of the parents, the behavior of the child, whatever, it gets to the point where he or she can no longer be safely managed in the home, that allows you to jump to the front of the waiting list. So in that respect, it's sort of like the division is prioritizing the priority category of the waiting list, because they are allowing people in certain circumstances who are in line to jump to the front of the line.
And once someone has received, I don't want to say received an offer, but once they've gotten to the top of the list and they've received contact from DDD, what does that process look like for a family to explore the different residential options? Are they given options, or are they told that there is an opening at one place and take it or leave it? What does that look like?
Well, the take it or leave it in a non-emergency circumstance is definitely not the case. However, the answer to the rest of the balance of that question is it depends, right? That's a good lawyer's answer. It depends. But some of it is luck, and some of it is just timing and fate. But generally speaking, when a person reaches the top of the list and they've completed their CCP application, and now we're on the CCP and we're looking for actual out-of-home placement options, let's say with provider agencies, what will happen is that you will work with your support coordinator to come up with various placement options. There is a system which is used that a profile is created for your kid. He or she's put out on a network. It's sort of like the disability version of online dating. You're going to create a profile for your kid. You're going to go out there, and various provider agencies are going to either swipe left or swipe right in order to determine whether they're interested or not in your child. And depending on who's out there, and depending on what kind of openings are available, with respect to each of those provider agencies, you may have 2 provider agencies that are interested in your kid. You may have 10. It really is going to depend at sort of on the circumstances at the time. Once folks have expressed interest in your child, or believe they can serve your child appropriately in their program, then various visits will be scheduled by those provider agencies to meet your son or daughter, for you to meet the provider agency, for you to see the potential placement. There is supposed to be opportunity if we decide that we might really like each other, again, to use the dating metaphor, then there's going to be opportunities for the potential adult participant to go over to the group home or to the house or to the apartment and interact with the other participants that might be living there, and maybe have dinner, and then as time goes by, maybe an overnight or two will occur. before we actually make the placement. An ISP or IHP will have to be developed. And then, of course, 30 days after the placement is effectuated, a post-placement service plan meeting is conducted to determine if the placement's going smoothly. Are there additional supports that are going to be necessary? Is it really an appropriate placement? And so forth. So it is sort of like a courtship in those circumstances, and it will depend who's out there, because the perfect agency might not have any openings, or the perfect agency might have 5 openings. It really does depend on the circumstances as they exist at the time.
Paul, can you talk a little bit about if someone is living at home, they come to the top of the priority waiting list, the parents and the individual agree that it may not be the right time. If the parent owns a mother-daughter house, a duplex, can they use a voucher to help fund some of the cost of living at that house?
Well, a great question. So to back up a little bit, any number of circumstances, the duplex, the mother-daughter, et cetera, yes, we have the child live in the daughter side of the mother-daughter. We use the CCP budget to pay for the human resources and the DSPs and that side of the dwelling, and of course mom and dad are right there. The problem is that again, when you're dealing with vouchers, if you have to, the stumbling block becomes who owns the real estate. Remember, a person, the individual who's going to receive the voucher can't live in a residence owned by a parent, a spouse, a sibling, a child, and so forth. There's a certain radius of familial status that if the dwelling or the property is owned by that person, then a Section 8 voucher or a supportive housing connection voucher isn't allowed to be used. So, and I don't know how many people are willing to give up the title to their real estate in order to get a Section 8 voucher. So it becomes a problem. That's when you get into circumstances, or particularly if you're buying a condo or an apartment and you're having that condo or apartment stuck into a 501 or a trust or a LLC, then you're finding someone else who's outside of the radius to be the manager or the owner or the operator of that business entity, at least on paper. So the bottom line is it's not it's kind of a harsh line to draw, but again, you didn't make the rules and I didn't make the rules, and those are the federal rules now.
Perfect. And Paul, can you talk a little bit about residential placement under the age of 21?
I can. Well, residential placement under the age of 21 is actually not generally directed by DDD. That becomes the children's system of care, what you know is perform care. And it's a very different philosophy, and it's a slightly different system. If a child is in crisis and needs to be served outside of mom and dad's home, that can happen, but that is all done through CSOC, and that perhaps is a totally different discussion and webinar for a different day. But the philosophy is very different. A CSOC placement is, theoretically supposed to be temporary, and the objective is for reunification with the family. A DDD placement, particularly one off the waiting list, is considered to be, a permanent or lifelong placement. So, now there's plenty of CSOC placements that become permanent placements, and I would submit to you probably the overwhelming majority of them become permanent placements, and they are placements that occur, and in some instances, depending on the provider agency that's providing the placement under the age of 21, it may be a circumstance where the individual, ages out of their CSOC funding placement, and the Division of Developmental Disabilities may just pick it up. Particularly if that program has both a pediatric and adult component to it. Plus, don't ever overlook, sometimes in some circumstances, and sometimes it's almost easier, boards of education can be held responsible and be compelled to pay for residential programs as well. when the individual's behaviors or circumstances interferes with the child's learning to such a degree that the child can only be served effectively or educated effectively in a residential setting. Sometimes we back up on the school districts to pay for them. As you might imagine, school districts aren't often very keen on that idea, and they don't. They very rarely volunteer or sign up for those things, and sometimes it requires due process litigation in order to make that occur. So those are your under 21 options.
Great. So, Paul, I want to give you 2 more questions before we end today's session, and I apologize. I know that we're over.
It's okay.
The first question is going to be in regards to campus environments, farms, more of those group settings where it's not just a single family home within a community. Has there been any change within the state of how they're looking at that model for families?
Not that I've heard of. And as in fact, I think that my impression, based on conversations with the powers that be, is that those types of congregate, quote unquote, living environments, particularly the farmstead stuff and the campus-based stuff, is still frowned upon. Now, do I get a sense that the leadership of the division are as strident about that or as fundamentalist about that as the previous administration may have been? No, I think they are. I think the previous administration was a lot more adamant that campus-based settings or agricultural and farm-based settings, and worries over densities and the the space between people's apartments and homes and so forth. The current administration is a lot less jumpy or a lot less concerned about those types of things, but we're not quite there yet. As a matter of fact, I think we still have quite a ways to go if we ever get there, before the state will look upon these things more favorably. I mean, personally, I think while the division has come somewhat far in respect to allowing for families to sort of create their own and so forth, it's not, the answer. Well, one point in the 90s and early 2000s, the answer to everybody was a group home. Oh, your kid's ready? A group home. What do you get? You get a group home. So, it's a little bit different today, but I personally, I think that we're still limiting ourselves. There's a farm program isn't for everybody, a campus isn't for everybody, but it is for some people. And I think
Absolutely.
we're cheating ourselves as a state if we don't allow it. But that's just my soapbox.
Absolutely. And it's not a one-size-fits-all for
Exactly.
As many individuals are being served, there are different options that are going to benefit the different individuals requiring those supports and services. And I think that's where we really need to talk about the advocacy piece for families to really have their voice be heard, and what's going to be most successful for your child might not be most successful for your child's classmates or friends or other relatives, but making sure that options are available, I think, is the most important thing moving forward to have positive change.
You're absolutely correct.
And Paul, can you talk a little bit about, I talk to a lot of families in regards to housing options. And there's always a fear, right? I've experienced it myself. You have a fear of letting go, right? As parents, and I think a lot of times parents of individuals with unique needs, we oversee our children or adult children's lives a little bit more than we would oversee the lives of our other children who maybe do not have a disability. A lot of times hearing the fear in the family's voice, a lot of families want to know what protections are there. Are cameras allowed in group homes? Are cameras allowed in residential programs? And if someone opens their own group home setting with friends, let's say, can they install cameras in that environment? Would you have any answer for that?
Well, cameras is definitely a hot button issue, and it's an emerging issue. So, first of all, Melanie, I think that your question's poignant, and I understand where it comes from. I mean, I have an older brother with autism that has been residentially placed, and I've actually been residentially placed twice, and I know the worry and the, I don't know the worry and the heartbreak from a parent's perspective, but I've certainly had first round ringside seats to it all. So, look, no one's ever going to take care of your kid or oversee your child as well as you will ever be able to do. But, there's a certain reality to these circumstances. You're not going to be here forever as a parent. And so my general advice to families, and this is general advice. This is not specifics. Every family's a little different. You probably want to try and effectuate an out-of-home placement or, a permanent type of living environment while you're young enough and healthy enough and active enough to oversee it, advocate, talk to staff, be involved, before you as a parent, leave this world. That you can never be 100% certain about an individual's safety. And when you're talking about a vulnerable adult, particularly an adult who might be nonverbal or otherwise very vulnerable and easily manipulated, it is a nerve-wracking experience. Cameras are permitted, and some provider agencies, a couple of them that I know in particular, are actually exploring the installation of cameras in the living environment. Now, they have to be in the common areas. They cannot be in the restrooms. They cannot be in the bedrooms. So they have to be in the common areas of the home. And they can only be monitored by the people who are designated to be monitored. And they cannot be viewed by families, right? And they cannot be subpoenaed to be used in, a court proceeding, or they can be examined by law enforcement if they exist to investigate instances of abuse and neglect. They can be viewed by people at DDD to investigate instances of abuse, neglect, or exploitation. They can obviously be viewed by people who are employed by and designated specifically by the provider agency to view these things, but they do stay out of the reach of the family, both for curiosity purposes as well as, court proceedings. So they can be used, but they have their limitations for obvious reasons. And a lot can go on. And when I was a rookie lawyer very early in my career, I used to help investigate instances of abuse and neglect in state-operated institutions, both developmental centers and psychiatric hospitals. A lot can go on in areas that are not surveilled by camera, bedrooms, bathrooms, etc. But they do help. I mean, look, something's better than nothing. And not all provider agencies are going to embrace that idea, and it will be up to the provider agency itself to embrace the idea. And certainly if you run your own, nothing stops you from installing a camera in the common areas to help monitor the situation and make sure that you investigate effectively instances of abuse, neglect, or exploitation. So there's a lot more to be had on that, and there's a lot to be debated on that, and reasonable minds can disagree on that as well. And that is going to be an emerging issue probably over the next decade.
Absolutely.
All right.
Paul, thank you again, as always, for sharing your time with us. We greatly appreciate the information that you were able to share with the audience today.
All right.
Just to let everyone know who's attending right now, the Family Support Center of New Jersey will be hosting various housing-specific information sessions for 2019. So look for additional emails sharing registration information in the new year. Moving forward, you will be receiving a certificate of attendance along with a recorded version of today's webinar. That email should be received within the next 24 hours, so check your spam folders in case you don't see that come through. And also, as a reminder, as we hang up today, you will have a very brief survey that pops up on your screen. It's information, again, that you provide to us that allows us to better arrange webinars around topics of your interest. So thank you, everyone, for joining us. Please have a great day. And Paul, thank you again.
My pleasure. Thank you.
Bye. Take care, everyone.
All right. Bye, guys. Good luck.